Did you know that right now, millions of seniors across America are getting medical tests that their own doctor's guidelines say they should not be having? These are not rare or experimental tests. These are routine checkups that get scheduled year after year like clockwork. And here is the part nobody tells you. Some of these tests are actively putting your health at risk. I have spent decades working with older adults, and I can tell you that more testing does not always mean better care. After the age of 60, some of the most common screenings can trigger a chain reaction of procedures and side effects that leave you worse off than before you walk through that clinic door. By the end of this video, you will know exactly which 5 checkups I would personally skip after 60, why the science backs me up, and what to ask your doctor instead. Stay with me, because what I am about to share could be the most important health information you see all year. Comment below and tell me, how many routine medical tests did you have in the last 12 months? I will be replying to each one. You might be thinking, isn't getting checked out the responsible thing to do? For years, that was the message we all heard. Go to your doctor, get your tests done, catch things early. But here is what research has revealed over the last decade. The math changes dramatically once you pass 60. What protects a 45-year-old can genuinely harm a 70-year-old. The reason comes down to something called the risk-benefit balance. Think of it like a scale. On one side sits the potential benefit of finding a disease early. On the other side sit the risks of the test itself, the anxiety from a false alarm, and the danger of unnecessary treatment. In younger adults, that scale tips towards screening. But after 60, and especially after 70, the scale often tips the other way. Studies found that the harms of many screenings become front-loaded, meaning they happen immediately, while the benefits take 10 to 15 years to appear. If you are 72, waiting 15 years to see a benefit is not a realistic plan. Research shows that nearly half of all older adults receive at least one unnecessary cancer screening test in any given period. A landmark study from Penn State University, published in JAMA Network Open in 2020, analyzed more than 175,000 adults with an average age of 75. 59% of older men had received colorectal cancer screening past the recommended stopping age. An extraordinary 74% of older women were being overscreened for breast cancer, and overscreening is not just wasteful. It is actively dangerous. The U.S. Preventive Services Task Force, which is the government panel that sets national screening guidelines, has explicitly recommended against several of these tests for seniors. Most people have never been told this. Most doctors never bring it up. And that silence is costing people their quality of life. Let me tell you about Harold, a 74-year-old retired school teacher from Ohio. Harold was the picture of good health. He walked 3 miles every morning and felt sharp. His annual checkup included a routine PSA blood test, which screens for prostate cancer. His result came back slightly elevated. Within weeks, Harold was sitting in a urologist's office, terrified. He underwent a biopsy, then a follow-up scan. For 6 months, he lived under a cloud of fear and uncertainty. He stopped walking. He stopped sleeping well. In the end, his doctors told him the original reading was almost certainly a false positive. Nothing was wrong. Harold lost 6 months of his life to anxiety and procedures he never needed. His story is not rare. It is the norm. Comment, false alarm if something like this has ever happened to you or someone you love. Let me know your age as well. Before I reveal the 5 checkups, let me walk you through 3 dangerous habits that make this problem much worse. The first is getting tested out of fear, not out of symptoms. Here is what happens when fear drives your medical decisions. You ask for every available test, your doctor obliges to reassure you, and you walk out with results that include something outside the normal range. That one out-of-range number sets off a cascade. Your doctor orders a follow-up test. That follow-up has its own risks and its own imperfections. Suddenly, you are 3 procedures deep into a problem that may not even exist. Researchers at the Loan Institute found that 16% of Medicare patients who received a routine EKG before simple cataract surgery experienced a cascade of additional testing and procedures within just 90 days. The EKG itself caused the harm, not any underlying disease. But here is the shocking part most people do not know. The medical term for this is cascade of care, and it is one of the leading causes of unnecessary hospitalization in seniors. Every test carries a small chance of a false positive, meaning the test says something is wrong when nothing is wrong. For PSA prostate tests, research shows approximately 75 to 80% of positive results are false positives. Out of every 5 seniors who receive a frightening PSA result, 4 have nothing wrong at all. Yet each of those 4 men gets sent for biopsies, repeat tests, and monitoring that carries real physical and emotional risks. The second dangerous habit is confusing screening with diagnosis. A screening test is done on people with no symptoms, looking for hidden disease. A diagnostic test is done when you already have symptoms. This video is specifically about screening tests done on seniors who feel fine. If you have symptoms, you absolutely need testing. But if you feel well, many of these screenings offer risk without reward. What they do not tell you in most waiting rooms is that the guidelines supporting these tests were built around younger patient populations. They were not designed with a 78-year-old in mind. The third dangerous habit is passive acceptance. This happens when you go to the doctor and simply agree to whatever is on the standard checklist. A 2024 study from Northwestern University Feinberg School of Medicine found that when doctors were given an alert reminding them that a PSA test for a man over 76 was not guideline recommended, screening rates dropped significantly. Without that alert, doctors kept ordering the test out of habit. Your doctor is human and busy. Sometimes they need you to ask the right questions. Comment, "I am guilty" if you have been going along with every test on the checklist. Do not worry, you are about to learn exactly how to push back. Now I want to tell you about Margaret, a 71-year-old grandmother from Texas. Margaret had been getting annual mammograms faithfully since her 40s. After she turned 70, she received a suspicious result and was called back for additional imaging, then a biopsy. The biopsy confirmed a very small, slow-growing finding. Her oncologist recommended treatment. She went through weeks of radiation and suffered side effects that left her exhausted for months. 2 years later, her oncologist admitted that given her age and the slow nature of what was found, watchful waiting would have been appropriate. The treatment likely made no difference to her longevity, but she had already lived through it. Her suffering was real, and it was largely avoidable. This brings us to the countdown. Here are the 5 checkups I would personally never get after 60. Number 5. Routine annual mammograms for women over 75. Mammograms genuinely save lives for women between 40 and 74, and the U.S. Preventive Services Task Force strongly supports that range. But here is what happens when routine mammography continues past age 74. The rate of overdiagnosis, which means finding cancers that would never have caused symptoms or shortened life, climbs sharply. A 2023 study highlighted by the National Cancer Institute found that approximately 31% of breast cancers found through screening in women aged 70 to 74 would likely never have caused harm. Research published in BMC Cancer found that continuing screening beyond 74 is associated with minimal benefits and increasing harms. Those harms include false positive results that lead to imaging, biopsies, surgical procedures, radiation, and the crushing psychological burden of an unnecessary cancer scare. If you are over 75 and still getting annual mammograms because nobody has told you otherwise, this is your moment to have that conversation with your doctor. The next one will surprise you even more, so stay with me. Number 4. Colonoscopy. After age 75 to 80. Colonoscopy is one of the most effective cancer screening tools ever developed for younger adults. But here is what happens after age 75. The risks of the procedure begin to outweigh the benefit of finding something. A JAMA Network Open study found that the cumulative incidence of serious complications within 30 days was significantly higher in adults 75 and older compared to those aged 50 to 74. Research shows that patients over 75 face approximately 4 to 6 times the risk of bowel perforation compared with younger patients. Perforation means a tear in the colon wall requiring emergency surgery. The American College of Physicians issued clear guidance. Clinicians should stop screening adults older than 75 at average risk who have no symptoms. Colon cancer typically takes 10 to 15 years to develop from a precancerous polyp into a serious threat. A 76-year-old with a negative result today is extremely unlikely to develop dangerous colon cancer from that finding before other health factors become more relevant. Yet studies found that 59% of older men are still getting these procedures past the recommended cutoff age. Let me tell you about Raymond, a 78-year-old retired firefighter from Georgia. Raymond had perfect colon health. His new doctor, not fully aware of his history, scheduled a routine colonoscopy as part of his care package. During the procedure, Raymond experienced a small bowel perforation. He spent 4 days in the hospital recovering from emergency surgery, developed a brief infection, and required antibiotics for 3 weeks. He lost 12 pounds and took 4 months to return to his previous activity level. Raymond went in for a screening he did not need and came home from a hospitalization he never expected. This is not a scare story. It is a documented, quantifiable risk that the guidelines exist specifically to prevent. Now this is important. What is coming next involves 2 tests that your doctor almost certainly offers every year without question. Number 3. Routine EKG for asymptomatic seniors. An EKG, or electrocardiogram, records the electrical activity of your heart. For someone with chest pain or known heart disease, an EKG is critically important. But here is what the evidence shows about doing it routinely in seniors who feel just fine. The U.S. Preventive Services Task Force recommends against screening with resting or exercise EKG for the prediction of coronary heart disease in asymptomatic adults at low risk. Their finding is clear. The harms of routine ECG screening are at least small and may be substantial. Here is what happens when a routine EKG turns up an abnormality, which is common in older adults due to age-related changes. Your doctor sends you for a stress test. That test comes back borderline. You get sent for a cardiac catheterization, which is an invasive procedure where a tube is threaded into your heart. That procedure carries real risks, including bleeding, arrhythmia, and stroke. Research from the Lone Institute shows that nearly half of all American patients receive at least one low-value cardiovascular test annually, creating avoidable complications. But here's the shocking part most seniors never hear. The test that started this chain was not even recommended for them. Let me tell you about Dorothy, a 68-year-old yoga instructor from California. Dorothy was active and completely without cardiac symptoms. At her annual physical, a routine resting EKG flagged a minor abnormality. Her doctor referred her to a cardiologist, who ordered a nuclear stress test. That test showed a small area of reduced blood flow. She was referred for cardiac catheterization. The performing cardiologist told her afterward that her arteries were fine for her age and no intervention was needed. Dorothy spent 3 weeks in intense fear, paid over $2,000 in out-of-pocket costs, and was placed on a blood thinner she did not need for 4 months. Her original EKG showed an age-related pattern, not a disease. Comment heart worry if you have been through a cardiac testing spiral that started with a routine screening. Number 2. Whole-body CT scan as a preventive checkup. These scans have become popular, with clinics advertising them directly to consumers. The pitch is appealing. Get a full-body picture of your health and catch anything lurking before it causes trouble. But here is what they do not tell you. A study from the University of California, San Francisco, published in 2025, found that CT scan overuse could account for approximately 5% of all new cancer diagnoses annually in America, representing more than 100,000 new cancer cases every year. The radiation from a single CT scan is hundreds of times more powerful than a standard chest X-ray. But here is the shocking part that is even more damaging for seniors. Research shows that the majority of findings on whole-body CT scans in healthy people are incidentalomas, which is the medical term for accidental findings of unknown significance. A shadow on your kidney, a small nodule in your lung, a density in your liver. Most are completely harmless, but here is what happens when a scan finds one. Your doctor must follow up. That means more scans, more radiation, possible biopsies, and crushing anxiety. An American Journal of Röntgenology study confirmed that detection of incidental findings in low-risk populations generally results in low-value and potentially harmful care. You walk in healthy and walk out with a problem that was never a problem to begin with. Before I reveal the number 1 checkup on this list, which of the first 4 surprised you most? Comment below and let me know. Number 1, the most problematic checkup for men over 70, the routine PSA test. PSA stands for prostate-specific antigen, a protein produced by the prostate gland whose level in the blood can suggest prostate cancer. For men in their 50s and 60s, a discussion about PSA testing is reasonable. But here is what happens for men over 70. The U.S. Preventive Services Task Force makes a firm recommendation against PSA-based prostate cancer screening for men 70 and older. The CDC echoes this directly. Men 70 and older should not be screened routinely. Research shows that approximately 75 to 80% of positive PSA results are false positives. That means 4 out of 5 men who get a frightening positive result have nothing wrong with them at all. A 2024 study from Northwestern University Feinberg School of Medicine found that PSA testing rates in men over 76 dropped significantly only when doctors were electronically alerted that the test was not guideline recommended. Without that nudge, doctors kept ordering it out of habit. Studies found that treatment following an unnecessary PSA diagnosis leads to urinary incontinence in a meaningful percentage of men, along with erectile dysfunction and bowel problems. Stephen Purcell, MD at Northwestern, put it plainly, if a man is not going to live another 10 to 15 years, you will not save his life from prostate cancer by screening him, but you will subject him to the potential harms of treatment. The scientific consensus is clear. For men over 70 with no prostate symptoms, this test causes far more harm than good. Let me tell you about Frank, a healthy 73-year-old from Florida. Frank had a slightly elevated PSA on a routine blood panel and was referred to a urologist. He underwent 2 separate prostate biopsies. After the second, he developed a fever and needed antibiotics. His final diagnosis was a very low-risk, slow-growing area of cells that his oncologist recommended active surveillance for, meaning no treatment. Frank spent 7 months terrified he had cancer, endured 2 invasive procedures, and paid thousands in costs. And in the end, the answer was, watch and wait, which is exactly what would have happened had he never been tested at all. Here is what makes all of this information truly powerful. These 5 checkups are part of a larger pattern. the assumption that more testing automatically equals more safety. When you understand that pattern, you can apply the same thinking to every appointment you have. Instead of routine blanket screenings, focus your energy on symptom-driven care. Ask your doctor specifically, is this test recommended for someone my age with my health history? Studies found that when patients ask this question, rates of low-value testing drop significantly. Focus instead on what actually shows proven benefit for older adults: blood pressure management, blood sugar monitoring, medication review, fall risk assessment, and cognitive health. These are the areas where proactive care delivers real, meaningful results. Bring a written list of questions to every appointment. Do not be afraid to slow down and say, "Let me consider this." Now, a word of caution. Everything in this video applies specifically to average-risk seniors who feel well and have no symptoms. If you have a personal or family history of certain cancers, genetic risk factors, or current symptoms, your situation is entirely different. Your doctor may have excellent reasons to continue screenings past the standard cutoff ages. This video is not a replacement for your individual medical care. Always consult your healthcare provider before stopping any screening program. If you feel dismissed when you raise these questions, consider seeking a second opinion or asking for a referral to a geriatric specialist. You now have knowledge that most people in waiting rooms across this country do not have. You do not have to accept unnecessary tests as part of getting older. You do not have to follow a checklist designed for someone half your age. You have every right to ask questions, slow down, and make decisions based on your individual story. The 5 checkups we covered today are all areas where current science says risk frequently outweighs reward for older adults. Knowing this is not frightening, it is empowering. Comment one of 3 things right now. Comment, "Protected," if you will bring this up at your next doctor's appointment. Comment, "Grateful," if this gave you information you wish you had sooner. Comment, "Sharing," if you know someone who needs to see this today. If honest, research-backed senior health information is what you want, please subscribe to this channel. Every week I bring you what the science actually says. Next week, I am revealing the 5 medications that doctors routinely prescribe to seniors over 65 that major medical organizations now say should be avoided. Hit subscribe so you do not miss it. You deserve healthcare that treats you as an individual, not just a checklist. If this video helped you, share it with someone who needs this information. You might save their life.